Hi, Amani.
Hi.
I see you have applied for clinical psychologist. So today you came here to do the job interview. So what attracted you to this position?
Actually, I believe that I have a talent to understand human psyche,
Mhm.
and I'm a good listener. Also, I like help people in need. I am very interested in the function of the brain and cognitive therapy, also like cognitive behavior therapy. I am also able to work effectively with different like personalities. I can be balance empathy with professional detachment. So like I also like I am able to win the respect and confidence of the people I serve. All of these examples like should show my interest in psychology, as well as my great potential in this like.
Okay, I see. That's really good. Okay, do you think you can handle the education and skill requirements of this job? I mean, are you directive or non-directive?
Actually, yes, I do. As what I said before, I have a great background in this field and I have TOEFL experience. I work with both inpatient and outpatient and I did everything that required in this job. I also have skills and the ability to that would fit me in this like work. So I am professional speaking both Arabic and English.
I see.
Extensive experience in education, educational outreach on a clinical psychology issue, proficiency in using a computer and other application, proficiency in listening and confidence and leading other people, proficiency uh, or like but like sorry what's the other like part of the question.
Are you directive or non-directive?
Okay, so yeah, back to this second part of the question. Actually, like directive person, I often lead people for what's right and what's good for them.
I see. I see. How have you used your skills of psychologist that you learned to help you success in your personal life?
Mhm. Actually, like being patient and attentive listener and able to lead people and motivate other are the skills that influencing my personal life.
Mm-hmm.
So, for example, like being patient helped me during my study in the US. So I left my family, I left my job, my friend, my country, and put everything behind me
Mm-hmm.
and face every difficult that I had to reach what I want. So I was very patient, like so I left my family for almost like 4 years and sitting alone without no one with me. So that was difficult, but being patient helped me. Also like being attentive listener like helped me making the people around me love sitting and coming to me
Mm-hmm.
because I always like listen to them without saying stop or like feeling bored. So these skills like affect my personal life.
I see. Okay. What are important or more important academic credentials or experience on job for you to enter the profession, and why?
I agree that the academic credentials like are important to have a background and to be more knowledgeable about the field that you study. But I believe that the work experience are more
Mm-hmm.
important. Like for example, like when I was studying, I just like get many information or a bunch of information. But when the year's finished, everything is gone.
I see.
But when I start like practicing what I study, that like make me like more professional and learning more without forget any information.
I see.
So.
Yeah, I can see from your resume you had pretty good work experience,
Mhm.
and you're very qualified. I mean, your
Thank you.
academic credentials very qualified for the position. Okay, do you believe everything can be treated through analysis and meditation, and why?
Actually, yes, I do. Specific if the diagnosis is correct, and the psychiatric, the psychologist, and the team that
Mhm.
work with the case are working very well and put all their concern on the patient
Mhm.
and his situation or her situation. Also, I believe if the patient help the team, like coming on time, never like give up, and listen to what they say.
Mhm.
So from that,
I see.
everything like will be fine and good and will be treated.
Okay, I see. Makes sense. Is it appropriate or proper for a practicing psychologist to use a patient's background information outside of the therapy without without his or her consent or permission, basically? And why not?
Of course, no. Like the team or everybody has the right to reach the patient file, doesn't have the right to use any of this information or any information that could lead to this person out of the therapy session.
I see.
Even if we want to exchange information with one of the teams, like team's member, like we have to ask the patient to give us like permission to use his like information to just help him or use as an example sometimes during the lecture that we have like in the clinic.
I see. Yeah, that makes sense. In terms of work experience, do you believe that the longer a professional practice in this field or in the field, the more that he knows about the conditions and why?
I can say somewhat.
Mm-hmm.
I believe that because like I am saying that because being in the field for a long time, it's good like to be professional, to get like more knowledge and being more knowledgeable. But at the same time, like through the years, everything's like are changed. So, for example, like in the past, there is no one like use a computer in within the like, session
Yeah.
or in the clinic.
Mm-hmm.
So they just like depend on paper, pen or pencil. But on these days, like everybody use the computer. If you wanna like get the patient records, the patient information, anything that related to the patient, we can get it from the computer. So these people who are all professional couldn't like use the technology these days or facing difficulty with that. But the people like just like graduate or get these filed, they could use it like more easily and being familiar with these like condition.
Yeah, that's right. All right. Walk me through a situation when you handle a risk position during your work in the clinic. What was the situation? What did you do? And what was the result?
Mm-hmm. Actually, like during my working at Military Riyadh Hospital, uh, we were like working with inpatient and outpatient. So one day, I finished like my work in the clinic, so I go to the inpatient admission and I was talking with one of the psychiatric.
Mm-hmm.
So about a patient who we just like stopped giving him a medication and put him in a seclusion room for a while to restart like a new medication with him.
I see.
So he couldn't leave the room because he have like withdrawal like symptoms. So and he is dangerous and risk like for all the other patients or the people in that area. While like my conversation with the psychiatric, like he just like whispered to me like, Amani, like the patient is coming, so be careful. When I hear that,
Mm-hmm.
I feel like I'm dying, like a big risk coming to me. I don't know if I'm gonna be alive or no.
I see.
So at that time, I remember to be not resist like or to not resist the patient, the psychiatric patient. So I just like turn my body
Mm-hmm.
and try to be relaxed. And when he came close, I just smile and say, "Hi, how are you? Are you okay?" I hear no response from him, and I saw another person. He is not the person that I know, like dirty face, dirty clothing, red eyes. So he just like when he came close to me, looking at my face, he just like grabbed my neck. So I was shaking, but I tried to be relaxed. I took a deep breath, and I looked down. I didn't like resist. So a few minutes later, when he saw me, did nothing. He just like left me.
Mm-hmm.
At that moment, all the nurses come over him and took him back to the seclusion room. So that one of the experience. Fortunately, I have it because I get more experience how to deal with this situation, and I always say, I always I always imagine there is no risk like that will happen to me, but it happened. So fortunately, that happened to get more experience.
So you learned from this experience, you might kind of be in, dangerous situation that you might, kind of threaten your life,
Yeah.
and you know how to kind of, let's say, risk yourself, and
Yeah, or
Okay.
imagine the situation. Yeah, very well. So.
that's good. That's good. All right. The final question: what are your strengths that can qualify you for this job, and what are your weaknesses that can disable you from doing the job properly?
Like talking about my strength, like I am able to work effectively with different like personality. I am a good listener. I am proficient in speaking Arabic and English very well.
Mm-hmm.
I am patient. But on the other hand, like I would like to learn how to interview
Mm-hmm.
or having an effective interview that could lead the patient talk more freely without like asking him many questions. Also, like I would like to learn when I have to ask, when I have not, when should I ask, when I should not, like what's the good time to ask, what's the not good time like to ask these questions, and what the good reacts that this therapist like should do like when he listen like to one of the patient answer or
Mhm.
like how to react when the patient ask especially private like questions, like for example like one of my patient was talking to me about something that is not acceptable in my culture. So when he was talking about that, I have no like facial emotion, so that could lead the patient like talk more free I mean. So that what I would like improve, or what I could call it like weakness. It's not weakness, but I would like to improve it. So
And how do you think you can improve it?
taking taking courses in the interview, asking the old like professional who has like a long time as what I said to you, like people who has like a long time working in this field have more information or being more knowledgeable, so that could give me like more experience and trying, so or practicing that, so that would like improve.
All right, we are pretty much done. Did you have any question for me?
Actually, no.
All right, Manny. We will let you know within a week. We will contact you by either by email or give you a phone. So thank you for coming today.
Thank you for you.
Good luck.
Thanks.
Thank you.
Thank you.